It's Wednesday, October 10th, and I'm your host, Paula Hersey. On today's show, we learn more about the SHINE program that helps those who are seniors or disabled navigate Medicare and gap insurance. And the deadline is looming for grant proposals to the Mid-Cape Cultural Council. Here's some news you can use. Now is the time to bark. A public hearing has been set for October 25th at 10 a.m. on the proposed rules and regulations for Barnstable's first dog park. The park will be open 7 days a week from sunrise to sunset. The full list of proposed rules and regulations can be reviewed at the town's website, www.townofbarnstable.us. Serving the health insurance needs of everyone, or more commonly known as SHINE, is a federal program with locally trained counselors that are available to residents who have Medicare health insurance. These specially trained SHINE counselors can help you navigate and understand your insurance and find ways to save you money. Open enrollment starts October 15th, and in studio to tell us more about the program is Barnstable County SHINE Program Director Tracy Benson. Are you confused about Medicare and the coverage that you need? Open enrollment coming around the corner October 15th. With me today, Tracy Benson, SHINE Program Manager for Barnstable County. This is such a huge topic for seniors in our community. Tell us first, what is SHINE? It's an acronym for something.
It is an acronym. It stands for Serving the Health Information Needs of Everyone. And when we say everyone, it's really everyone on Medicare. So you could be under 65 disabled and have Medicare, and then you also may be eligible for Medicare when you turn 65. So we have two different populations that we serve.
Okay. And as program manager for the county, it's your responsibility to kind of train all these volunteers up?
Yes. So anyone that would be interested in volunteering for SHINE would have to go through a very intense training. It's about 8 to 10 days, full days of training, and then we have monthly meetings that one would have to attend. And we just go over the information again every month.
Okay. So. And these counselors are trained specifically on what people would need for insurance?
Well, it's A to Z Medicare. Yeah, so it's what Medicare is, how one would navigate through Medicare, and then really all the options that go along with original Medicare, like maybe a supplemental policy or a prescription plan, or maybe even a Medicare Advantage plan. So there are a lot of options that come with original Medicare that's fairly hard to navigate through, and that's really what a SHINE counselor, we're teaching them all of that in hopes to communicate to the beneficiaries.
Okay, so I went through this recently with a couple of family members signing up for Medicare, which is confusing unto itself.
Yes.
Yes. And then realizing that it doesn't cover everything. So SHINE counselors can help you understand the insurance coverage at the bare bones of Medicare, and then what do you have to add to it?
So typically, yes. So original Medicare is really what we would consider Medicare A and B, and that's not 100% coverage. So even if you were to walk around with your Medicare card, you know, you have a lot of out-of-pocket expenses. On the medical side, 20%. On the hospital side, you have a fairly large deductible, as well as a deductible on the medical side. So even just original Medicare, although good coverage, definitely has some what we would call gaps in coverage. Okay. And original Medicare does not cover prescriptions, which everyone should have that prescription coverage. So we have to think of ways of, okay, I have this Medicare coverage, I know it has some gaps in it, I understand it doesn't have prescription coverage, now how do I fill in those gaps? And that's really what a SHINE counselor would be talking to you about. You know, what are your finances, what is your health, how do you feel about risk, what kind of things would be the best options for you?
Okay, and that really brings us to coverage when we talk about the different types of insurances. For example, if you have prescriptions currently, you're going to need a fairly robust prescription plan.
Right, so we want everyone to carry prescription coverage, and in fact there is a penalty if you do not carry prescription coverage. So we really do try to encourage everyone, even if you're not on medications, to carry a prescription plan, because you can't predict the future on that.
Right.
And a prescription plan is really as good as what's going to cover your medications. So whether it's on the lower end of a premium or a high-end type of premium plan, you know, the best plan for you may not be the best plan for me because it's strictly based on your medications. Out of all options, we're trying to find that one plan that covers what you are on as an individual and allows you to go to the pharmacy that you would prefer to go to, because that's another important piece. and we kind of look at those two things together to find you the best drug plan.
Okay. And then saving money too, that seems like a misnomer when we talk about healthcare these days.
Yes.
But there were plans out there which I thought were interesting. So one of my family members is really healthy, doesn't have any prescriptions at all, and another is on dialysis. So these ways to save money, does a Shine counselor work with the insurance companies or no?
We're going to be giving you unbiased information, so we're not getting incentives from any of the insurance companies. We're really just trying to find out of all the options, which is the best one that's going to cover you, that you find affordable, and is really just going to give you the best coverage without breaking the bank. Right. And these plans change from year to year, which is why open enrollment becomes very important to you to take a look at what do you have for plans, what's changing with those plans, and you just want to be on the best plan that's going to save you the amount of money that you want to save.
Right. So the Shine counselor really literally is independent. And is their mandate, their purview really literally is just to help you save money and find the right plan that fits you.
It really is all about finding the right plan that fits you. We don't want to see anyone overpaying because they didn't understand something, or picking a really high-priced policy because they feel like the more I pay, the better that policy might be, because that's not always the case. And so we really just try to help them navigate that, because it's very difficult.
It is really difficult.
Yeah.
And then let's talk a little bit about all these words that get bandied about. The Advantage plan, that's very confusing. They sound like they're the best plan, but they're just words, right?
They are just words. And you'll hear those same words, Advantage, quite frequently. Okay. And it really boils down to who do you want to be your primary insurance carrier is really what it boils down to a lot of the times. Advantage plans are, we could describe them almost as replacement plans, because Medicare Advantage plans become your primary insurance carrier. And when something is your primary insurance carrier, say it be a Tufts or a Blue Cross, those are the physicians that you're going to be allowed to go to. Where if you had Original Medicare as your primary insurance carrier, the network is a little bit larger because you can really see anyone in the country who accepts that has signed the Medicare contract. So they're very, very different things. Original Medicare and, say, a supplement versus a Medicare Advantage plan.
Okay. And we'd noticed that even in our own searches that some people don't actually, doctor's offices carry the Medicare. So you do need those supplemental plans to actually get a primary care some days.
The Medicare Advantage plans are separate contracts, so a lot of physicians may not sign a Medicare Advantage plan contract, although a lot of them or most of them are still signing the Medicare contract. That's why you really need to understand who is your primary insurance carrier, because if you've replaced Medicare with a local company, then you may not be able to see the physician that you want to go see if they haven't signed that contract. So there is a lot that goes into it. It's very network-based, and that's why we're really here to try to make sure that everyone is on the right plan. And the commercials look great, but you want to make sure you're really researching what it is you're enrolling in.
Right. Those mailers that people get at their houses too, they seem to be designed to confuse you, to say, this is the only plan that you can get. But no, there's a lot of different plans. Even here in Massachusetts, which we're a little more strict on our insurance plans, there's a lot of carriers.
There are still a lot of carriers. And yes, they're all vying for your attention. So those mailers and the advertisements on TV are always going to look like they're selling the greatest things since sliced bread. And it may be for you if you've done the research. If all the stars align, I tell people, then perhaps that is a nice policy for you. But sometimes something's not going to align for you. They may not cover your medications. They may not allow you to go see a physician that you've had a relationship with. So you don't want to get stuck in something that's just not going to be the right plan for you.
Right. And some of these plans, dental, vision, are those all wrapped into some of these plans
Medicare
as well?
Advantage plans, because they are network-based, so they are sometimes going to restrict where you can go. So what they have done to maybe offset some of that is they will have additional benefits that, say, Original Medicare doesn't have. And a lot of them, the dental, the vision, some of them have hearing. Those are the key things that people are looking for that Medicare may not cover. And so as an incentive for these plans, they're going to offer those benefits.
Okay.
May be worth it, may not,
Right.
right? You may pick that plan because it has great dental, but if you can't see your doctor,
Right.
then that's not going to work for you.
So we've talked about plans where we kind of understand that we need help. The whole application process to this is mind-boggling. Never mind for somebody who might be internet savvy, but for those who aren't, is there help with a Shine counselor for applying for things like this?
Sure. So if you meet with a Shine counselor one-on-one, if you have the ability or want to enroll yourself after you've made the decision, then that's fine, but we also will help you enroll. I do a lot of the enrolling right in my office with clients.
That's
Just
fantastic.
get it done so that when they leave, everything is all set and they don't have to think about it.
Right. And you're not the only one out there. Our
I'm not the
senior
only one out
center in Barnstable has wonderful Shine counselors as well. So tell us a little bit about the network of Shine counselors. How can people find this help?
So Shine counselors, for Cape Cod and the islands, I have about 60 Shine counselors that cover the region, plus myself. So the best way to find a Shine counselor is probably to contact your local senior center. The only senior center that does not have a Shine counselor would be Wellfleet. Okay. So if you're from Wellfleet, you can contact me at the regional office, and I'm happy to help. I'm happy to help really anyone if they can't get in touch with their local Shine counselor at their local senior center, but that's probably the best way to reach a Shine counselor, is to contact their local senior center.
And we know Barnstable Senior Center has...
They have many Shine counselors there. Many of our sites have multiple Shine counselors.
Right.
And they will be busy during open enrollment. So call early if you want the appointment, and then at the regional office, we can see anybody.
Okay. And even though you have all of this done, open enrollment, you mentioned this earlier, but I want to kind of stress this for folks. You really want to take a look at your insurance now.
Yes. So open enrollment is everyone on Medicare's opportunity to take a look at what they have, what's changing going into 2019. So you're going to think about your finances, you're going to think about your health, you're going to look at your medications, and you're going to think to yourself, am I overpaying? Is there something out there that's a little less money, maybe more comprehensive coverage? This is the time. This is the window to really take a look at what's going on and make changes so that when January 1st comes, you feel confident and good about the coverage that you have.
So that's October 15th through
December 7th is the last day.
Okay.
And once that window shuts, there are other windows, but this is the biggest one. So it really is a great opportunity, and I really encourage everyone to take a look at what's going on. Because you may feel like what you have is working, and it might be working, but there might be something else out there that will work just as well and maybe be a little less money. So we're all about trying to save money, as we all are. So if there's an opportunity to do so, it's worth a 15-minute sit down or a conversation with a Shine counselor to make sure that you're on the best thing for you at the lowest price possible.
This was fantastic information, Tracy. Thanks so much for
thank
joining
you. Thank
us.
you for having me.
The Mid-Cape Cultural Council is providing grant funding for projects in Barnstable and Yarmouth and is seeking project applications. The Council will provide grants to organizations, schools, or individuals for activities in the arts, humanities, and interpretive sciences. MCCC Chair Marilyn Hebring and Treasurer Rachel Youngling joined us in studio with more information on submitting a proposal by October 15th. Do you have a love of the arts? Do you have a project that you want to bring to the community and need funding for it? Well, the town of Barnstable has the Mid-Cape Cultural Council, who is now accepting grants and grant proposals. So with me today is Chair Marilyn Heberlin and Treasurer Rachel Youngling. Welcome, ladies.
Thank you.
Yep.
So this is the time of year that the Mid-Cape Cultural Center loves, is that you start to get proposals in from the community in order to fund art projects, but also science and humanities as well. So Marilyn, tell us a little bit about the Mid-Cape Cultural Center. What does it do?
Well, primarily that is what we do, is we give grants in those areas. But we have branched out and we are doing public art and other things. We work both with the town of Barnstable and the town of Yarmouth. Okay. So we accept grants from anyone on the Cape, but we do look at primarily grants that serve people in those communities, but then often there are grants that serve people all over the Cape, which would benefit people in those 2 townships.
Okay. And Rachel, where does the money come from that funds these grants?
Very good question. We are funded through the Massachusetts Cultural Council, which gets all of its funding from the legislature. So it goes into the state budget. This year they were awarded $14 million in funding, and of that we've been allocated $12,800 to grant to the community. We still have to go through a process to decide what we still have remaining from prior years, so that amount could actually rise.
Wow, that's great. That's some good money for organizations and individuals to bring to usually our underserved communities. So talk a little bit about some of the criteria that you look for in a grant.
Well, we would like it to serve the populations of those 2 townships, but we like to see that it's serving youth, it's serving people that sometimes aren't accessible to the arts or the humanities or the sciences. One of the projects that we funded last year was called Amazing Grace, and it was an arts program for children of incarcerated adults. And it was a small program, not really benefiting a large number, but benefiting, I think, a very underserved number. So that was the kind of thing that we like to look for. We often have given to larger groups like Rise and Shine, which again benefits youth in the community. We have given to schools, libraries, with science programs, Mass Audubon.
We did an outstanding grant last year for, it was through Mass Audubon, Long Pasture, and Matakees Middle School, and they were actually doing a head starting program of the spadefoot toad, which is an endangered species. So the students were getting to learn about the endangered species and foster its development and then release them back out into the vernal pools, which was really exciting to bring the science and bring different groups together that hadn't been able to work together before.
Oh, that's fantastic. So talk a little bit about this application process. You know, when I think of grants, I'm like, oh my gosh, there's so much writing. But if you're prepared to do this, it's all online?
It is all online. All the applications will be at the www.mass/culture.org, and you can go on there, and this goes for all local cultural councils. All the applications will be up there. And one of the unique availabilities of this is that you don't have to be a 501c3 nonprofit to apply for these grants, which with many foundations you do actually have to be. So we really like to fund local artists that are trying to make a living as a local artist, and they're not a nonprofit. You go onto that application site, and as long as you have your information together, substantiation in the form of agreements with whatever organizations you'll be working with, or a letter of understanding if you're going to be offering programming in a school, you can scan that information in and add it to the document, and then we just need a brief description of what you're planning to do and who it will be serving within the local community.
Right, and it's all fill in the blanks kind of thing.
Yeah,
It's a
definitely.
fairly easy process to do, and you can save it if you're not
You can
finished.
save it if you're not finished and come back to it at a later time.
Yeah, and the more extra information you can give, the more helpful it is. It's hard. Well, last year we had 45 applications, and it was quite a bit to weed through and to read and to make sure that you're not missing a really good program. So the clearer you are, the better, the more you can substantiate what you're doing, your budget, how you're using your money, those kind of things. But again, it's all just fill in the blanks on the application on the online.
Right, and I thought that was a great statement by you. It doesn't have to be a nonprofit. The ukulele kids come to mind because that's the woman who does that is an artist here on the Cape.
Exactly.
And she comes into an underserved school, gets the kids ukuleles, and they learn to play.
Yeah.
And we heard them play. They
yes,
were just
They were outstanding and so
Fabulous.
passionate.
Yeah.
And this is an instrument they might not have had access to otherwise. otherwise because it's not part of the public school curriculum.
Right. So when does this all end? Is there deadlines that people need to be aware of?
Yes, October 15th is the deadline for the online filing, and you can of course reach out to us at midcapecouncil2@gmail.com with any questions. We're happy to support anyone through the application process or answer questions if you really haven't flushed out the full program and you need some support. We're here to do that too, because we really want to see artists and individuals be successful in this process.
Right. So October 15th is the deadline, and then the Mid-Cape Cultural Council, what's the next timeline that people start to think about?
Really,
Yeah.
it'll be the next grant cycle. We do the grant cycle once a year, so it's always an October 15th deadline. So that'll be when our next grant comes up. But we do have a project underway as well.
Yes,
That's going to be
and
coming up in
we
the spring.
review the grants, the council reviews the grants on our November meeting.
Okay. So they would know maybe by the end of the year,
Yes,
beginning
yes,
of the
yeah,
year,
yeah.
if they had gotten a grant.
Yeah.
That's a great Christmas present.
It is a great Christmas present, yes. We have a self-imposed deadline of December 31st to notify, but we're usually completed before that and can get notice out before that.
Okay. And congratulations on your public art funding. You made your
We did.
numbers and
We
had the
did.
community kick in. So tell us briefly what your project is and how it benefits the town of Barnstable.
Well, this is the Discovery Walk, and it's down by the harbor, and we foolishly or hopefully think that eventually there will be other sculptures. So we have begun, we have 2 sculptures. We are seeking a third. Their deadline for that is September 30th. There's a lot of information out there. That it will connect to Main Street, and it's all interactive and fun, so that you can sit on a rocking boat and or see birds fly. It's been a project, and it will continue, but we're really excited. It's going to be fun.
And one of the pieces we're quite excited about is we did receive an $11,000 matching grant from Mass
Right.
Development
Yes.
for creative placemaking. So we had to go through a vetting process, and they found that this community was deserving of this project, and it was really going to improve the vitality of that area.
That's fantastic. And when you went in front of town council, you had an opening statement. Can you share that with us? Because I thought it was wonderful.
Well, I said I have to confess that I am a Washoe Shore New Yorker as of 4 years ago, and I was very involved in the arts there. But the delight here and the difference is that in New York there is only one arts council, and it's in New York City, and it takes applications from all over the state just in that one place. And when I came here and I discovered what a wonderful idea that these are local people on the council. They are taking grants from local organizations. They are working with the local town council, and it's all something that is very accessible and very friendly, instead of looking at a grant that is up on the Upper Peninsula or so far away that you don't even know what these people are talking about. So I'm glad to live here.
That's fantastic. So October 15th is the deadline for requests for proposals for granting for this year in the arts, the humanities, and the sciences, or blend all three.
Yeah.
We love that.
Yeah.
and look to serve the 2 communities. Anyone from the Cape can obviously submit an application, but primarily the towns of Barnstable and Yarmouth.
Correct.
Have I forgotten anything?
I don't think so.
I think
No.
you've been very thorough.
You know this process, yes.
I know the process a little bit,
Yeah.
having been a member of the Mid-Cape Cultural Center. Well, good luck in this
Thank
grant
you.
process. I know it's a lot of work, and it's a lot of really great people deserving it.
Yes.
Yes.
Thank you so
Definitely.
much.
Thank you.
Thanks.
Here are some election calendar important dates coming right up. October 17th, last day to register to vote for the November 6, 2018 town election. October 22nd, early voting begins in the town clerk's office, 367 Main Street, 8:30 a.m. to 4:30 p.m. November 2nd at 4:30 p.m. is the close of early voting. November 5th, noon, absentee balloting closes. The clerk's office will close at noon to prepare for the state election. November 6th, State election polls will be open from 7 a.m. to 8 p.m. Reminder for Precinct 1, your new voting location is at the Zion Union Church at 805 Attucks Lane in Hyannis. And a reminder for Precincts 10 and 12, your new voting location is at the Seventh-day Adventist Church in the community building adjacent to the church, 2736 Falmouth Road, Route 28, Marston's Mills. Here's a look at this week's meeting schedule for boards, commissions, and committees. Comments, suggestions, accolades, connect with us on Facebook and Instagram. Email us or send us an old-fashioned note by carrier pigeon. Channel 18 works. For you, I'm Paula Hersey, and thank you for watching Barnstable Today.